Want to welcome you to the Price is Right, sponsored by the North Central Florida chapter of the Right Care Alliance. And it's my pleasure to introduce your host for tonight, Dr. Ashby. He is a fourth-year senior medical student in the UF MD PhD program. He's completed his PhD in genetics, applying modern sequencing techniques to advance new gene therapies for patients. He also has a master's in public health, specialized in policy and management, has been a co-founding member of the RCA since 2018. Welcome.
Yeah, thanks for the introduction. I appreciate it. So we're just going to be hosting one of our events, which we've done just to kind of highlight the issues, as you all may or may not know, of the exuberant costs associated with healthcare. I'm just going to pass on to Dr. Southwick, who's been preparing a lot of these numbers together and getting together all of these figures so that we'd be able to sort of compare and contrast the different prices across different health systems.
Great. Thanks, Ricky. I think everybody knows me. I think this is you'll find this a very interesting exercise. And this is based on the Price is Right. And the rules of the Price is Right are whoever picks the price closest to the published cash price of the service or diagnostic without going over that price wins. So Ricky is going to monitor. You're going to type in what you think the price is on chat. And then Ricky will pick the person that comes closest to the value without going over. Now, we're estimating the price on 4 different services or diagnostic tests at 2 different hospitals within a 50-mile radius of Gainesville. And the 4 procedures that we're going to compare 2 different hospitals within that region are mammography, cardiac echo, emergency room visit, and abdominal CT scan. And I'll go over these in a little more detail as we go along. So first of all, where are we talking about? We're talking about Northern Florida. And for those that don't know Northern Florida, here's St. Augustine, this arrow right here. And this is the region. And the most northern, which is 50 miles from Gainesville, is HCA Lake City. Another one that's about equidistant north is St. Vincent's in Clay County. And then in Gainesville itself, there's UF Shands, or University Hospital Medical Center, and HCA North Florida. And then a little bit to the east in Putnam County is Healthcare of America, Putnam, HCA Putnam. And then the south of us is Marion County, which is that's a horse capital of the United States. And here there are 3 medical centers: Advent, HCA West Marion, and HCA Ocala Regional Medical Center. So those are the 8 centers that we're going to compare the prices to, and you're going to try to guess what price is right. So the first procedure is mammography, and I think most people understand mammography as an X-ray used for early detection of cancer and other breast disease, and used as both a diagnostic and a screening tool. So the first question is, what is the cash cost at UF Health Shands? What do you guess is the cash cost if you were to pay it out of pocket for UF Health Shands for screening mammography? I'm going to play a little music here. Give you 1 minute. Type it in chat. Ricky, when you see everybody's got it, you can let me know. We'll go 1 minute, 1 minute. Okay. So what is, let's see, I
I
don't
think
want,
we actually have no winners. I think everyone went over for this first one.
oh my goodness. Okay, well then, if everybody went over, why don't we give it a little more time? Okay, so everybody went over, go lower. Okay, I'll start the diabetes thing again. We'll give it another 30 seconds. Okay, do we have
I'm
somebody?
a rusty old boat hitch.
Oop, they got ads in this now. Oh, God. Okay, let's see here.
Yeah, so we have a tie essentially between Daniel Vargas and Paul Haddis.
Okay, just 1 second. Let me get up here. So the price is for UF Health, $227. Okay, so we had a tie.
Yep.
Okay, we'll put them right. We'll keep you both. Well, the plan is we're going to do these 4 procedures and our therapies. I've been to 2 hospitals, so that'll be 8 answers, and then those will be the 8 winners, or maybe 9 winners, and then we're going to have one more estimate for 1 hospital and 1 procedure, and that will be abdominal CT scan with contrast. So that will be, and the winner will get a $25 gift certificate to Amazon. Okay, so that's for UF Health. So what is the cash cost for HCA? What do you think the cash cost is for HCA Lake City Medical Center?
And I am barely hanging on. See ya.
Hey, how are we doing, Ricky?
I think we're good.
Okay. Let's go return to.
Yeah, so that's definitely David Glenn.
Okay, great, David. Congratulations. So what was the price? The price for HCA Lake City is $783. Okay, so quite a difference. And if you look at all of the costs in our region, the 8 hospitals, Advent of Ocala and St. Vincent's and UF Health were all in the 200 to 300 range, while HCA North Florida was 956, Lake City was 783, Ocala, there was no data, and then Putnam County was 782. So the range of cost, published cost, and this is on turquoise.health, which has the public posted cost, can vary by 4.2 times from 227 to 956. Now let's turn to cardiac echo. So cardiac ultrasound, also known as echocardiography or echo, is a non-invasive procedure that uses sound waves to create images of the heart. So the microphone, the transmitter just goes over the heart on the anterior chest and transthoracic, and the images can help evaluate the heart and nearby blood vessels and evaluate the structure and function and help diagnose a range of conditions. So it's widely used. And I must say, when I'm in the wards, I order cardiac echo quite frequently to assess cardiac function. So the question now, the estimate is, what is HCA Ocala Regional Medical Center's cash charge for cardiac ultrasound. How are you doing, Ricky? Okay. So let's return.
So it looks like Stephanie won this one.
And the answer is $10,768. So that's Ocala Regional. Remember, that's just south of UF Health. So now the next question is, what is the cash charge published for UF Shands, the major medical center in our area? So again, let's go back and estimate that price. Careful, don't go over. Good. Okay.
So David actually won this one, and I just wanted to note that he actually wrote that before you even said and gave the warning.
Oh, good. Okay, David, very
He's the
good.
only one who didn't go over.
So $783 for UF Health. So let's look at all the hospitals in our region. Again, Advent Health was close to Shands. St. Vincent's was quite a bit higher. North Florida is the highest at 15,805, with Ocala Regional Medical Center becoming the second, and Lake City, Putnam, and Lake City and Putnam were substantially lower for reasons that aren't clear. But the price varied from $763 to $15,805, or 20.7-fold difference in published charges. Okay, so now let's go to the emergency room care, intermediate severity of illness, called level 3. Now, what does that mean? We had some confusion. We had another Price is Right before. What that is someone who has the potential to increase in illness that could increase in severity and could require 3 or more resources and needs to be seen within 30 minutes. That's the definition. The lower the number, the more serious. If you're 1, you're life-threatening, you need to be seen instantly. And if you're level 2, you should be seen in 10 minutes. If you're level 4, 1 to 2 hours. And level 5, you probably don't need to really be seen that day, and you'll have to wait for treatment. So what is the charge for HCA North Florida for level 3 urgent but not life-threatening care? What do you think they charge? Okay, is everybody entered, Ricky? How are we doing?
We got pretty much everyone.
Okay, good. Okay. And so the answer,
Yeah, so
Hope
David's
everybody's
gonna be
sitting
the
down.
closest.
$6,927. Okay. Who got that?
That's David
Yep.
again.
David. David, you're killing. Who's next? We were supposed to have one. We're supposed to have only one winner. You're supposed to only win once. Was there anybody else that came close?
After that, it'd probably be Stephanie.
Okay, but didn't Stephanie already win too?
Yep.
Who's next?
So yeah, we have Katie Southwick would be after that.
Okay, good. So Kathy won that one. So keep track of those. Each winner, we're going to list those at the end. Okay. Now let's go. The same drill for what do you think UF Health Shands charges for the same treatment? Good. Okay.
Everyone's busted.
We're good?
Everyone busted. So no one
Everybody
won.
busted. Okay, we got to go back. Go lower. Go lower. I'll give it 30 seconds. 30 seconds. Okay. Does anybody get reasonable?
Yep, that's definitely Sharon.
Good. Okay, good. Okay, so the answer is $387. And so let's look at this region. UF Health comes out, Shands comes out the lowest at 387, followed by Advent and Ocala, followed by St. Vincent's. And then all the HCAs are all in the 2,000, 3,000, and with North Florida leading the pack at 6,927. So the variation in cash charge published is 17.9 times. So that's pretty amazingly extreme. Now, what I'd like to do is I want to take a little break and play a little video, if I can find it now, it's from TikTok, and there's this American Healthcare. I recommend you go to TikTok, and it's American Healthcare, and it really is startling. Let's see if I can find it. Let's see, 1 second. Yeah, here it is. Okay. Oh, darn, where is it? Oh, here they are. Sorry. I knew I had them. Okay, so. Oh, these are. Actually, I think this one is. I think. No, that's not. Darn, I got so many different videos. See if I can find this one. I had it before. Darn. I apologize. I'll do one that'll give you an idea. It's not the one I wanted, but it's pretty good. This one is on pregnancy costs in the United States.
These are all hospital bills. So let's see what it costs to have a baby in America. First one is $100. Number two, $7,000. Oh, $429.84. That's not so bad. Like shaking. I thought we owed $7,000. Number three, $150 even. $1,371.70. Let me add up the total. $2,051.54. Now, I was curious what they charged my insurance, so let me go do that. My insurance paid $10,942.39.
Oh, shoot. You don't hear it at all?
I hear it, but
Oh.
it's on the bottom and you're on the.
Oh, I'm sorry. Okay. Yeah, I don't know. I don't know how it didn't share the video, but you get the idea. I
Yeah,
apologize.
I saw the video and heard it.
Oh, good. Weird. The iPads didn't show up in the iPads. Okay.
Oh, yeah, no, we saw it.
Good. Okay, good. Okay, so that way I thought we'd take a little break from prices. So that's pregnancy. The other video I was trying to find was a young man who had 5 stitches in his hand, and they charged him $3,000 for 5 stitches. And then he went back to the same emergency room to get the stitches removed, and they said they would charge him over $1,500 to remove the stitches. So he fed up and said, "I'm not paying that." And the nurse gave him a little suture removal kit, and he had to do it by himself. So it just emphasized the outrageous costs that an unsuspecting patient can experience. But I'm sorry, I couldn't find that one. Okay, so let's now return to our final estimate, and that is abdominal CT scan. Now, abdominal CT scans with contrast are really very helpful. And I can tell you in the emergency room, they used a great deal of the time because this is how, when you have abdominal pain, you can find abdominal abscesses, a ruptured bowel, appendicitis. You can actually make the diagnosis of appendicitis with a CT scan with contrast most of the time. So it's a very helpful test. And here, this one, as you can see, this is the liver right here. And you can see these shouldn't be here. It should be a smooth, homogeneous. And here, this is multiple cystic abscesses of the liver, in this case, shown by CT with contrast. So it shows it's a very powerful tool, very effective, and used very frequently in our emergency room for people that have abdominal complaints. So what do you think the cost for a CT scan with contrast is for UF Shands? How we doing, Ricky?
Looks like David wins.
Okay, let me, so who we got to, so the price is $680. So, was anybody else below that?
Stephanie and Sharon, but they both already won too.
Okay, no one else? Okay, we'll have to declare David a double winner, that's all. We actually had two winners for another one, so that'll work out. Okay. Okay, so now the question is, what is the cost at HCA North Florida for the same procedure? Okay, just gonna back that up and they just stopped.
Yeah, so Daniel Vargas definitely won that one.
Oh, good. Someone good. Daniel, okay,
man.
let's see here. So $17,102. So looking at our region, it went anywhere from $680 to $17,102, a 25-fold difference. And as you see, North Florida is the highest, but the other HCA hospitals are the Putnam and Lake City are in the 9,000. Ocala Regional and West Marion are 5,000 area. UF Health Shands is the lowest, followed by St. Vincent and Advent Ocala. So that now, so can we enter? Let's enter I want to enter the winners. Let's see, hold it. And then I want each winner to introduce themselves and tell them how they came up with their. So who was the first winner? Ricky?
I just put them in the chat.
Oh,
from top to
okay.
bottom.
Could you read them off? Just read them off. Let's
Yeah,
see.
so Paul Haydes and Daniel Vargas, they both tied for that one.
Hey, how do you spell it? H-A-I?
Hattis, and it's Paul.
Oh, Paul.
Okay.
Okay, Paul Hayes. And the other winner was who?
Daniel Vargas, so Daniel.
Okay.
Oh no. They both won the first one.
I know that's
They-
okay. Okay. I know.
And
Okay.
then, yeah, so also we have David Glenn, Vivian Talon, Stephanie Ains.
I'll just put Vivian. Okay, and Stephanie. Who else?
Yeah, I'm not sure if it matters if it's in the right order, but we had ties for multiple ones.
Okay. Give me the next. Yeah.
Yeah, so we also have Katie Southwick,
Okay.
Sharon Surrency,
Okay.
and the rest are just repeat winners.
Okay. So we have 7 total of new winners. Okay. Okay. So could each person, Paul, introduce yourself and tell us about yourself and why you're interested in prices for healthcare.
Sure. I'm Paul Hattis. I live in the greater Boston area, and I'm somebody who's been very much interested in the whole issue of overall healthcare spending and healthcare costs. The thing that struck me, we always know, or at least from the literature, the for-profits are higher in pricing, although I didn't always appreciate the magnitude was was as great in the cash pricing. For some of the nonprofits, if they have a cash paying customer, I thought they wanted to collect significant amounts too. But so that was interesting to me though. But there was variety here of threefold up to 8 to 20-fold. So that was interesting to me throughout the procedure. So
Good.
thank you.
Yeah. Daniel.
Hi, I'm
Yeah.
Daniel. Yeah, I'm Daniel, and I kind of got interested in this just because I'm part of the exec board for the UF chapter of this club that's opening up now.
Great. Yeah. Welcome.
Yeah. So Elise brought me into it. She's in
Yes.
here.
Yeah. Elise is on. Elise didn't
Yeah,
get any of them right.
no.
No, I did not.
But I was interested in it. Well, she's my friend, so I wanted to help with it. But I was also interested because my family is from South America, and obviously down there it's socialized healthcare. So coming over here, the cost was, significant to say the least. And looking at that discrepancy and seeing how, things can be amended or worked into the system was really interesting to me.
Oh, good. David.
Hey, all, I'm a nurse and an activist outside of Washington, D.C., and member of the steering committee for RCA nationally. And yeah, I'm interested in these issues for a whole bunch of reasons. But yeah, as we all know, people don't get care that they need if they expect to be hit with bills like this. And yeah, I would guess that if I did well on these, it's probably from spending some time a year or two ago looking at the turquoise prices for similar procedures for DC area hospitals. So, yeah,
Yeah. I think
so
the
some of
point
those
is
numbers might have stuck in the back of my head.
this is not unique to North Florida. That's the point. Yeah. And Steph.
Hey, everybody. I'm Stephanie Ains from Massachusetts. I think I know pretty much all of you. Honestly, the numbers that I guessed right were the ones that I said, I'm just going to guess a random number. There's no way, like, it's got to be way off. And those were the ones that were right. The ones that I actually put some thought into. I was real wrong about that.
And my wife, Kathy. You're on mute, sweetie. You're on mute.
All right, sorry. Obviously I'm married to you. And we've discussed this and I've heard you talk a lot about it. And yeah, I have the inside scoop for sure. Yeah, and it's absolutely mind-blowing how the two main hospitals in the city that we live in can be so far apart from each other as far as prices. And Fred and I are getting out there, and I've had 2 hip replacements, and we've had our share of health issues. So, it's very good information to know. And I'm definitely going to Shands.
And finally, Sharon Sorensi.
Yes, hi. So I'm Sharon Sorensi, and I am a pastor in a rural community and work with a food pantry and a crisis intervention program. So I'm particularly interested in this because of what my clients experience when they have no health care coverage. And my guess on this was purely based on comparing what we looked at before and what the prices might be in the next round. So
Right,
it was
yeah.
purely a guess.
Yeah. And as you'd predict, the same hospitals are the high chargers for everything. And the ones that were low cost were low for everything. And I really don't know exactly why UF Health, Shands, is so much lower than everyone else. My theory, and I've got to I'll talk to the billers, is that we know when someone comes in without health insurance, that means they don't have very much money. And therefore, to give a huge cash price is unrealistic and will throw them into bankruptcy. And UF does not want to do that. Curiously, HCA has bought up all of the rural hospitals, these outlying hospitals, and where the same problem as Sharon is describing is don't have insurance. The people don't have insurance. So they must be wanting to gouge that population and make money off them. That's the only thing I can figure out. I'm not sure. It certainly doesn't sound very altruistic, whatever they're doing. But I think
Fred, can I
yeah.
say something to your
Yes.
wife for a moment about?
Yeah.
So, I don't blame Katie for wanting to go to Shands, but if you have private insurance, I'm guessing, but for sure for Medicare, I will almost bet that Shands, the federal government pays more to Shands for those procedures than they do to HCA under Medicare. That Shands gets a higher payment. That's not true under these cash prices, as we saw. And for private health insurance, it might well be the fact that the medical center of that complexity also gets a higher negotiated price. So the fact that the cash prices are a lot higher at HCA doesn't say that who's higher on private insurance
No,
or
no,
Medicare.
exactly.
It shows you the complexity of all this stuff. So.
Exactly. Yeah. Yeah. Turquoise only had published negotiated prices for very few insurance companies. And many times the only hospital that had them for all was UF Health. The rest didn't have them. So we couldn't really compare the negotiated prices, but they were for HCA, they were consistently much, much lower than the cash price. That was not the case for UF Health. The insurance prices were actually higher than the cash prices for UF Health. So
for UF Health is Shands, right?
Yes, UF Health is Shands.
Yeah. So it just shows you the rules of the system are quite complex when it comes to payment and levels.
I mean, how does anybody? You can't be. The point is, you can't be an educated consumer. It's impossible. So let's do. So we're to the runoff. We're going to do one more estimate, and this is going to be for MRI of the lumbosacrospine with contrast. Now, magnetic resonance imaging uses a contrast material, and this helps doctors see the lower back vertebra and the spinal cord and the spinal canal. And she shows the disc very clearly. For this is the spinal cord, the very bright, and you can see that right here. I think this is L5. There is L4-5. There is a disc herniating outward, actually compressing the spinal cord. So it's a very, very effective way of looking at disc herniation, as well as other ways that the cord is compressed, causing back pain. So the question here is, what is the cash price charged by HCA Ocala Regional Medical Center for a MRI of the lumbosacrospine with contrast? We just have the winner's estimation, because this is the runoff. Ricky, there should be 7 answers.
Everyone.
Got them off? Okay. So let's see who wins.
So Sharon won.
Oh, good. Okay, very good, Sharon. So the answer to this one is $9,820. And again, if you look at the prices, UF Health Shands is $945. So we anywhere from $945 to $9,820, or a 10.4-fold difference in price, cash price. So again, all over the board. And again, Advent, St. Vincent's are second and third, and then North Florida, Lake City, Putnam, Ocala, and West Marion are all much, much higher, much higher. Okay, so the winner is Sharon Cerency. Sharon, congratulations. And I think can you put in the chat your email address, or your, actually I can send an email. I'll send you a gift certificate by email.
Oh,
$25.
wow. Thank you.
Okay, very good. Okay, so what, I wanted a little discussion. What can we conclude about the published cash costs of healthcare treatments and tests. Do these prices reflect supply and demand? They reflect the cost of performing the treatments and tests? Or what do people think? I know Paul had some comments already.
Right. I would say they have no relationship to the underlying costs of care in terms of some of these cash prices that we're seeing.
Yeah. And Ricky, we were talking about, Ricky is, got a master's in public health. Ricky, your thoughts?
So we talk actually a lot about this in grad school for my master's, and a lot of times, especially for private institutions, it's common for them to really artificially inflate their cash price for a number of reasons. First off, it serves a negotiation purpose because they have to negotiate their own rates with insurance companies. So if they drive up the average cost of local procedures in the area, they have better negotiating power, they have better anchoring power because you're starting off at a higher number, so you can negotiate it down and still get a 50% discount and still be well above what you would normally charge for that procedure. It also has the indirect effect of, unfortunately, driving away a lot of low-income patients, which in our area, I can comment that it's, kind of said amongst the ward that we are kind of a dumping ground for local hospitals in the area. Unfortunately, these HCA hospitals, they do want to keep their mortality rate down, they want to keep their infection rate down, and they want paying customers. So the net effect of that is we wind up getting a lot of referrals from these HCA hospitals that honestly shouldn't happen just because it's a really sick patient or it's an under-income patient who's likely going to be indigent on their bills.
Right. Yeah, I was talking to Joe Lyons, who's on the rights RCA for Gainesville, and he is actually in Philadelphia, but he's a great resource. He's been a hospital administrator for over 3 decades, and what he said is what hospital systems charge is whatever the whatever the market will bear. So whatever they can get away with, they will do. So it doesn't have to do with competition. It doesn't have to do with supply and demand. It doesn't have to do with the cost of performing the treatments. It's whatever they can get away with and not get in trouble, they will do. And so, I personally think it's time that maybe patient advocacy groups call these prices to task and ask why their prices are 25 times higher than UF Health.
There's not another market, another business, retail or otherwise, that can get away with this. This is the only business we see this significant a variation.
All right. Good. Okay. Well, so thank you. That was really a great series. And Jeff is just going to give a little overview. I think almost everybody is familiar with the Right Care Alliance, but I think we have 2 or 3 people that don't know as much. And Jeff is going to just go over a little bit about the Right Care Alliance.
So this is a great statement. To heal our country, we must heal the heart of healthcare, patients above profits. And that's really one of the things that we advocate for. We're looking for healthcare to really benefit the patient. And you can see in this slide, Right Care is right in the middle and the heart of everything, whether it's healthcare as human right, ending corruption. Affordable medicine is a big one that we've lobbied for. Empowered patients. It is uniquely American. We are one of the only industrial nation that has a system like this. We're looking for universal coverage, and I think there's so much that's misunderstood about that. And it's some time we sit down and talk about that and look at it as a real option. Hospitals that serve the communities, and we need to restore the patient-clinician relationships. So how do we get there? Well, we build a network of engaged and enraged. Things we've talked about tonight. We need everybody. We ask so much of the communities because that's the only way our voices will be heard is if we all get engaged and we voice our opinions. We organize around key priorities. Activate and unleash the power of the people. It doesn't sound like each person can do a lot, but we found out with our insulin campaign that every little bit, every group helped to start getting that process and getting the prices of insulin down. And then we need to develop leaders, consolidate power, and catalyze social movement. That's so big. We need to work together. Everybody has a voice and everybody can make a difference. I know we all think as one person we can't, we can. This group, this organization, the Right Care Alliance, nationally proves that.
And I think everybody is joined, everybody here is actually a member of the RCA now, which is really great. And one of the things I would say, particularly to the students, a really key important thing about these campaigns is you develop leadership skills. And I tell everyone, medical students, if you want to learn leadership, join a campaign. You will learn all the skills of one-on-one interactions, of convincing people to work together. And just like, and in fact, from my experience, improving healthcare quality in the hospital is very similar to campaigning in the community. And these skills will be very beneficial throughout your careers. So with that, I thank everybody. Any closing marks? Any other thoughts before we end?
I did want to say this is one of the events we've done. The rightcarealliance.org website has some great, as we all should know, has some great resources. There's a podcast we did a little over a month ago, hopefully to do more in the future. Help us hopefully to get the word out to everybody, not just the people that are members right here.
One person that's on that hasn't commented at all is Alan Myers. Alan, do you have any thoughts on all of this? He's still there? I hope he may have been busy. Oh, there he is. Yeah.
I am. No, I think you guys have said it well. We got it. Everybody, there's a role for everyone, and I think people who are here know that. So the task is to get others involved as well. People you work with, your family, and your friends. There's plenty to do for everyone.
Yeah, Alan is a physician, has been active for years with the Right Care Alliance. And Alan, what do you think? Do you think a Boston edition of this would be worthwhile? Price is Right?
Well, we already did something like this, didn't we, Stephanie?
We did a national one. We didn't do a Boston specific one. We did a
Oh, yeah. Oh, and I think it's great. I think it's an eye opener for sure.
I know. I mean, did you really? I personally, until I really analyzed it this time, I did not appreciate the magnitude of the variation in costs and charges. It's insane. I mean, how can anybody tolerate this?
Well, we need a national health program is what we need.
Yeah, exactly.
That's what we're working for.
Great. So, Elise and Daniel, what do you think of all this?
I think it's great. I think this event was great. It's so shocking to see like how much healthcare costs every single time, you know? So yeah, I thought it was great.
Good.
Yeah, I also just had no grasp on the discrepancy between even in our own area, Shands and North Florida, especially the last question. Last year, I got that exact same MRI with contrast on my lumbar spine to see because I have a herniation between L5 and S1, the exact same MRI, but it was significantly cheaper than what we just guessed. So
wow. So yeah, what was it cost? Do you remember?
It was less than $1,000.
Okay.
I think it was.
Did you have it done at UF Health?
Yeah, it was at Shands.
That's right, yeah, because it's under 1,000 here.
Yeah, but it was the same exact MRI that you just showed, but it was $8,100 at North Florida, Ocala.
I know, really scary. Is your disc better?
A little bit. It's still herniated, but
having had those, they just take time. You just got to be patient. They'll eventually heal. Great. Well, good. Thank you, everybody, and I really appreciate you all participating. And it turned out really well. And Sharon, I will be sending you a gift certificate from Amazon.
Well, thank you so much. This was a surprise.
Okay. Bye.
Bye.
Thank you.
Bye, everybody.